The Ryan White HIV/AIDS program was named for a courageous young man named Ryan White who was diagnosed with AIDS following a blood transfusion in December of 1984. When Ryan White tried to return to school, he fought AIDS-related discrimination in his Indiana community. Along with his mother, Ryan White rallied for his right to attend school, gaining national attention, and became the face of public education about his disease. Surprising his doctor, Ryan White lived 5 years longer than predicted. He died in April 1990, only months before Congress passed the legislation bearing his name. In August 1990, the Ryan White Comprehensive AIDS Resources Emergency Act was passed. HIV has become a worldwide epidemic. The Ryan White HIV/AIDS program reaches an estimated 529,000 people each year. People living with HIV disease are on average poorer than the general population. Reflecting the demographics of HIV in the U.S., 71% of clients are male, 55 of those males are between the ages of 40 and 59, 73% are people of color, 48% are gay or bisexual men, and women now make up more than 27% of HIV/AIDS cases. More than 158,000 clients each year receive their prescriptions through state-run Ryan White AIDS drug assistance programs. Almost 75% of Ryan White patients are minority Americans who have higher rates of HIV infection and are more likely to reside where health professionals, screening facilities, and treatment centers are scarce. The program is the third largest source of federal funding for HIV care in the U.S., following Medicare and Medicaid, funded at $2.3 billion in 2016. Funding is distributed to states, territories, cities, and HIV care and support organizations in the form of grants. Federal funding for the program, which must be appropriated by Congress each year, began in 1991 and increased significantly in the mid-1990s. For many years thereafter, funding continued to increase but at slower rates and has leveled out in most recent years. In 2015, nearly two-thirds of clients had incomes at or below the federal poverty level, which in 2017 is $11,880 for a single person or $24,300 for a family of 4. The legislation was first enacted in 1990 as the Ryan White Comprehensive AIDS Resources Emergency Act, also known as the CARE Act. It has been amended and reauthorized 4 times, in the years 1996, 2000, 2006, and most recently in 2009. Under the Affordable Care Act, the Ryan White HIV/AIDS program has remained a critical component of the nation's response to HIV. The Ryan White HIV/AIDS program is the largest federal program focused specifically on providing HIV care and treatment services to people living with HIV. The Ryan White HIV/AIDS program is divided into 5 parts. Part A provides grant funding for medical and support services to eligible metropolitan areas and transitional grant areas. Part A provides things such as AIDS drugs assistant programs, early intervention services, home health care services, hospice services, and mental health services. To qualify for eligibility for Part A, an area must have reported at least 2,000 AIDS cases in the most recent 5 years and have a population of at least 50,000. Part B provides grant funding to states and territories to improve the quality, availability, and organization of HIV healthcare and support services. Grant recipients include all 50 states. Part C provides grant funding to local community-based organizations to support outpatient HIV early intervention services and ambulatory care. Part C also funds planning grants, which help organizations more effectively deliver HIV care and services. Eligibility for Part C, applicants must be public or private non-profit entities that are or intend to become comprehensive HIV primary care providers. Part D provides grant funding to support family-centered, comprehensive care to women, infants, children, and youth living with HIV. In order to be eligible for Part D, a public or private non-profit entity must apply. This entity must provide primary medical care for HIV-positive women, infants, children, and youth. Part F provides grant funding that supports several research, technical assistance, and access to care programs. Such programs include the Special Projects of National Significance Program, which supports the demonstration and evaluation of innovative models of care of delivery for hard-to-reach populations, and also includes the AIDS Education and Training Centers Program, who supports the education and training of healthcare providers treating people living with HIV. In addition to the eligibility requirements I have already discussed, to qualify for this benefit program, you or your family or household member must have HIV or AIDS and characterize your financial situation as low income. The eligibility determination process entails a collection of information on multiple criteria, most notably your HIV status, income, residency, and eligibility in other health insurance programs. The Ryan White HIV/AIDS program has a manifest goal to reach as many people as it can and that it does. It is the largest federal program focused specifically on providing HIV care and treatment services to people living with HIV. Due in no small part to this federal, state, and local investment, more people are living with HIV and AIDS now than dying from it. Although created to help AIDS/HIV sufferers, a Latin goal is to figure out how to stretch funding for the program as it cannot keep up with medical advancements which now allow for sufferers to live longer lives. In closing, like most programs where the government is offering assistance, there are very stringent qualifications that need to be met in order to meet requirements to receive aid. As the cost of decent health care continues to skyrocket, if I were to address any issues with the policy, it would be to revise the income requirements as defined by the federal poverty guidelines.